Hello everyone, Dr. Matt Ed. Today we'll talk about coronary angiogram views. As a general rule, for the left coronary system, and when the camera is pointed at the cranial views, the focus is on the left anterior descending artery. And when the camera is pointed at the caudal views, the focus is on the left circumflex artery. The first view I want to talk about is the LAO caudal view. And here is also known as the spider view. So the beginning of the film is the left main artery, and that breaks into the left circumflex artery on the right side, and the LAD on the left side. And sometimes if there's an artery in between, it's the ramus artery. So this is the trifurcation, but most of the time it'll be a bifurcation. The next view is the RAO caudal view, and the way I think about this is that if you rotate the LAO caudal view towards the right, you get pretty much the image here. So here you have the left circumflex coming down, and then the LAD is over here, and the diag that comes off the LAD pretty much creates a contour of the left ventricle. I also want to make a note that the LAD sometimes has this characteristic mustache branches. Once again, for the caudal views, the main focus is the left circumflex artery. Next, I want to talk about the cranial views. And reminder, cranial view focus on the LAD artery. So LAO cranial, you have the LAD coming straight down like this, and then the left circumflex is on top most of the time. The way I remember this is that LAO cranial view, you have the L, so L goes straight down, and therefore the LAD also goes straight down. For the RAO cranial view, going here, you just turn the image, rotate it a little towards the right for RAO, right. And so the LAD is a little towards the right side of the screen. And then the circumflex can sometimes be over here, or sometimes it can be up here. And the diag comes off of the LAD. The right coronary system, RCA, is pretty straightforward. Here you have the sino-arterial node, which feeds the sinus node. The conus artery node, which feeds the right ventricular outflow tract. Marginal branch that comes off of the RCA, and it continues on to be the posterior descending artery, the PDA, and it continues on to the posterior left ventricle artery. This is also known as the posterior lateral artery,